Today, the topic for discussion is diarrhea. At the end of this video, the students will be able to define diarrhea, discuss the epidemiological triad of diarrhea, list out the various modes of transmission, mention the signs and symptoms of diarrhea, specify the diagnostic test of diarrhea, explain the management of diarrhea, describe the prevention and control of diarrhea. Let's see the definition of diarrhea. Diarrhea is defined as the passage of loose, liquid, or watery stools for more than 3 times a day. Coming to the epidemiological triad, it consists of agent, host, and then environment. Coming to the agent factor, diarrhea is caused by various types of virus like rotavirus, adenovirus, coronavirus, enterovirus, and cytomegalovirus. It is also caused by various bacteria like E. coli, Shigella, Salmonella, Vibrio cholerae, Staphylococcus, and Clostridium. The other factors which contributes to diarrhea are amoebiasis, giardiasis, and other intestinal parasitic infections are also associated with diarrhea. So the diarrhea is caused by various types of virus, bacteria, and other intestinal parasites also. Next one is the host factor. So it is commonly seen among children in the age group between 6 months and 2 years of age. The incidences peak during the age group between 6 to 12 months. So it is the period where the child will move from exclusive breastfeeding to semi-solid food, that is weaning period. Diarrhea is more common in persons with malnutrition. Malnutrition will lead to infection, and infection leads to diarrhea. Poverty, prematurity, reduced gastric acidity, and then immunodeficiency, lack of personal hygiene, and lack of domestic hygiene, and incorrect feeding practices are all the contributing factors for diarrhea. Environment factor. In temperate climates, bacterial diarrhea occur more frequently during the warm season, whereas viral diarrhea, particularly diarrhea caused by rotavirus, peak during the winter. In tropical areas, rotavirus occurs throughout the year, increasing in frequency during the drier and cooler month, whereas bacterial diarrhea peak during the warmer and rainy season. Next, we'll move on to the modes of transmission. Diarrhea is transmitted mainly by the fecal oral route, that is, the water which gets contaminated with the feces and the food gets contaminated by the fecal matter, or by direct transmission with the feces. The 5 F of diarrhea transmission are fingers, fomites, food, flies, and then feces. So when the children play in the mud with the fingers, they are more prone to get diarrhea. Fomites, the objects which gets contaminated with the feces, through that the child may get diarrhea. And then food, contaminated food, and then fecal matter. These are all the various modes of transmission of diarrhea. Next we'll see the signs and symptoms of diarrhea. Dizziness, nausea, abdominal cramps, headache, passage of loose stools for more than 3 times a day, and fever. Next one is the diagnostic evaluation of diarrhea. It consists of history collection, physical examination, blood test, and stool examination. We are collecting history from the person in order to identify the reason of diarrhea, and then we are doing stool examination in order to identify the causative organism, whether diarrhea is caused by virus or bacteria or any sort of parasites. Next we'll see the management of diarrhea. Management of diarrhea comprises of 5 types of therapy: oral rehydration therapy, intravenous rehydration, maintenance therapy, appropriate feeding, and zinc supplementation. First, we'll see the oral rehydration therapy. It helps to prevent dehydration as well as to reduce the mortality rate among under 5 children. India was the first country in the world to launch this ORS formulation since 2004. So this is the composition of ORS which has been given by the World Health Organization and UNICEF. The ingredients are sodium chloride 2.6 gram per liter, potassium chloride 1.5 gram per liter, glucose anhydrous 13.5 gram per liter, trisodium citrate dihydrate 2.9 gram per liter. So the total weight of ORS is 20.5 gram per liter. Next we'll see the assessment of dehydration. So we have three levels of dehydration: mild dehydration, moderate dehydration and severe dehydration. In mild dehydration, the child looks irritable and the child has the sensation of thirstiness. On palpation of anterior fontanelle, it looks normal. On examination, the eyes looks normal and the tongue is also wet. On doing skin pinch test in the abdomen of the baby, it goes back immediately. The pulse as well as the respiration rate is also normal in case of mild dehydration. In moderate dehydration, the child looks irritable and the child is having extreme thirstiness. On palpation of anterior fontanelle, it looks depressed. On examination, the eyes are sunken and the tongue looks dry. On skin pinch test, it goes back slowly. The pulse as well as the respiration is rapid and feeble. In case of severe dehydration, the child looks drowsy or in unconscious state. The anterior fontanelle is strikingly depressed and the child is having sunken eyes and the tongue looks very dry. On doing the skin pinch test, it goes back very slowly. The pulse is very weak and thready pulse and the respiration is also very rapid and the child is having limited amount of urine output and the child is having severe weight loss, that is more than 10%. Next one is the intravenous rehydration. So this recommendation is given by the World Health Organization in order to combat diarrhea. First we have to administer ringer lactate solution for the children, followed by diarrhea treatment solution. The diarrhea treatment solution consists of sodium chloride 4 gram, sodium acetate 6.5 gram, potassium chloride 1 gram and glucose 10 gram. Next one is the maintenance therapy. After the initial fluid and electrolyte deficit has been corrected, oral fluid should be used for the maintenance therapy. For adults and older children, thirst is the adequate guide in order to fulfill the fluid needs of the patient following diarrhea. In case of mild diarrhea, 100 ml per day till diarrhea stops. In case of severe diarrhea, 10 to 15 ml per kg body weight per hour. Appropriate feeding. Breastfeeding is continued along with oral rehydration solution given after each passage of liquid stools. So after passage of liquid stools also we have to continue with the breastfeeding for the baby. And then next one is zinc supplementation. It is a new addition to the diarrhea treatment strategy. According to World Health Organization and UNICEF, they have recommended daily 10 milligram of zinc for infants up under 6 months of age and 20 milligram for children older than 6 months for 10 to 14 days following diarrhea. Next one is the prevention and control measures of diarrhea. In order to prevent and control diarrhea, we have to maintain certain sanitary measures as well as we have to improve our hygienic practices in order to overcome diarrheal diseases. First one is sanitation. We should have safe drinking water supply and the excreta should be disposed of properly, and then we have to improve our domestic hygiene as well as food hygiene and personal hygiene. Second one is health education. So we have to educate the people in the community regarding the importance of exclusive breastfeeding and the importance of weaning for under 5 children and clean drinking water, use of plenty of water for hygienic purposes and use of latrines and proper disposal of stools of young children, etc. Third one is immunization. Immunization helps to prevent against diarrhea. Nowadays we are administering rota vaccine 5 drops for children in the national immunization schedule in order to treat diarrhea among children. Last one is fly control. As you know the feeding habits of fly, it should be controlled well in order to avoid food contaminated with the fecal matter. These are all the various preventive and control strategies to overcome diarrhea. Next one is summary. Diarrheal disease is still common a public health problem. Diarrhea and malnutrition plays a vital role and is the leading cause of death among all the under 5 children. The degree of malnutrition as well as the degree of dehydration should always be assessed among under 5 children so as to rehydrate the child from dehydration. With this we are ending our topic on diarrhea. Thank you.